With dementia, it actually helps so much more to detect earlier.
As you take care of people and they're aging, it becomes more and more apparent that you have to focus on brain health.
Dementia care actually belongs in primary care.
If my mother would have received an early diagnosis, she would have had a better quality of life.
Having the knowledge now, it definitely has changed the way that I practice or plan to practice.
Speaking as a patient, my primary care team is so important to me. They're my first line of defense against illness. They're my wellness champions, and they're ideally situated to track my health across time. In those precious 15 or 20 minutes, they try to address all of my concerns, a list that's getting longer and longer as I age. So given every part of my body that they need to test, a question arises. What about my cognitive health? Specifically, should my primary care team do early screening for dementia? To try to address these pressing issues, I recently joined Dr. Anna Chodos, Executive Director of Dementia Care Aware, in sitting down with a wide range of experts in dementia treatment.
When I was training in primary care and geriatrics, I definitely felt the sense that many people thought because the diseases that lead to dementia syndrome of cognitive decline and functional decline, the diseases that lead to that often are incurable. So there's nothing we can do. There really isn't an advantage to detecting earlier if it's not seeming to affect people's lives. However, we know it is affecting people's lives. For example, we know that just correcting hearing in midlife can reduce cognitive decline by 30%. Treating depression when people are older can slow cognitive decline.
Once you have the early screening and you have the early detection in place, it opens the door, it gets you across the bridge to so many other options. But it is the rate limiting step, right? If you never open the door, you never get across the bridge, you don't actually have the opportunity to utilize any of these other resources we have available.
As you take care of people and they're aging, it becomes more and more apparent that you have to focus on brain health. And early detection becomes more important the more I think providers experience what happens when you don't detect early.
A secret, superpower of primary care is that we have these longitudinal relationships. We have this continuity with our patients. We get to know them. And so I think that's why I believe that this belongs in primary care. It doesn't make a lot of sense to me that we would refer this out when we're the best equipped to assess these different components of a diagnosis of dementia. You are the best physician to make this, screening and diagnosis and initial care plan.
Having a diagnosis of cognitive impairment early allows you to start to investigate where do we potentially need some help in the future, where might there need to be interventions made, and that just prepares the individual much better for the future that is to come.
It's hard to change practice. It's hard to change mindset. We're still dealing with a disease that about half of people never get a diagnosis. And of the half that do, only about half of them get it diagnosed and documented in their medical record. That's not how we manage care. We start with a diagnosis, and that allows us to think about what different pieces need to be in a care plan so that it's going to be effective.
Sometimes for providers, it feels like you're opening a can of worms and you really don't want to go there. There's also discomfort and stigma. Patients may be offended if their physician asks them, how's your memory? How's your thinking? Let's check it out. And yet we believe we need to get past that. We got past that with cancer. But we're sort of in the throes of being embarrassed by Alzheimer's and cognitive impairment. And we can get beyond that and we can do better.
We talk about doing a checkup from the neck up. Providers say to me, well, that's going to take so much time. And I'm like, well, you find time to do blood pressure checks. You find time to do eye checks. You just have to figure out the time to do this and incorporate it into your practice.
Don't feel like you have to make the diagnosis all at once in that 20-minute visit. It's okay if you do this kind of in pieces or in steps. Number two, you have to do the screen. You have to do the cognitive screen. If you can get your office staff to help you do that, that would be fantastic.
There are no silver bullets. And many of the things that we try to put together in terms of care also turn out not to work for everyone, not to work everywhere, and to have limitations that we didn't expect. This is a long-term project. We shouldn't get our hopes either too high or too low.
As dementia progresses, you might lose the ability to make certain decisions or to really choose the path that this condition is going to take for you, whereas earlier on you have more of a choice. Lifestyle interventions may have a bigger impact. You have the opportunity to correct hearing or change your medications to improve your cognition, and you've missed all of that if you get the later diagnosis.
Planning that patients can do before they lose the legal ability to do that on their own, before they lose legal capacity to do that, if done well, can be a gift to caregivers who work with them in streamlining their ability to have the tools to do what needs to be done on behalf of the patient.
My grandmother was diagnosed with dementia early on. Initially, it was like a mild cognitive impairment. It got to a more of a moderate severe stage where she was putting metal, like aluminum, in the microwave, stopped doing her regular routines of like walking to the store. And it came to the point where I had to become her full-time primary caregiver on top of working full-time as a clinical social worker in the hospital setting. One of the most difficult years of my life.
My parents had to stay with us for a couple months. So that's when I really, truly saw her symptoms. She loved to cook, so she wrote every recipe for me. And in between the recipes, she wrote, I know something's happening to me, and I'm losing my mind, and I love you very much. The very short paragraph, and I still have that notebook.
So you're trying to stay afloat and do the best that you can, even when you do know of the resources.
My mother started to say things that we knew weren't true. She developed some paranoia. At the time, we didn't know that that was aligned with some folks that do suffer from Alzheimer's. But we thought, okay, maybe she's just depressed or stressed out. She had caring doctors on her care team, but they didn't really do any cognitive assessments or nothing like that.
It's why early detection is important, but not just early detection with telling the patient, but early detection and including the caregivers and the care partners to enhance the life of your loved one who is suffering or living with dementia.
An early diagnosis would have prevented an emergency every month.
Had she been screened years ago, of course it wouldn't cure what she has now, but it would have definitely helped us.
The cost, if I can count how many hospitalizations she would have every year, but most importantly, she would have had a better quality of life. She would have been on the right medication. She would have had more time with myself and my father.
I think for any disease process, if you develop an instrument, it's our responsibility to make that diagnostic tool and that treatment available to as many people as possible, regardless of their backgrounds. It's as simple as that.
From the standpoint of a screening program, definitely that can help reduce disparities.
Things like language concordance, cultural concordance, having somebody who is sitting across for you who understands you, right? They understand the cultural norms you may ascribe to. They speak the same language.
We're like all put in the same container, but not all Latinos are Mexican and not all Mexicans are Latinos, right? And so how does the doctor or the provider speak or addresses the patient is very important as well.
My parents lived in East Los Angeles, so it was primarily Spanish-speaking. You were lucky if you had one Spanish-speaking doctor, but they would have most often translators, but their Spanish was not, it's different.
It's very different to talk about an illness that is, say, affecting your knee, right? Or your liver, and then doing that through an interpreter. But try to do that when it's a disease that is affecting your brain, and you're trying to express something that feels very deep to who you are as a person that is being affected by this disease process, and you can't do it face-to-face with someone that is understanding your language.
When we think about equity, I think we do a greater disservice to individuals with regards to equity by not screening at all.
That whole thing of the lone doc on their horse riding off into the sunset, it does not work. So what can we do? How much can medical assistants, let's say, begin some of the screening? What can a nurse do in clinic to support with the screening, to do perhaps some of the follow-up calls?
Providers don't have to do it alone. There are supports in our local communities. There's local Alzheimer's organizations. There's Adult Day. There are Meals on Wheels programs. There is so much in the fabric of our communities to support people.
And in the same way that we can connect patients to resources within the healthcare system, we can connect them to resources that are available to them in the community outside of the healthcare system, like advanced care planning, like housing, like financial management, a whole host of other things.
We are so lucky in California to have the leadership that we do on this issue. They're really tackling an issue that is affecting a really vulnerable group.
We have understood as a state that we need to work together. It's not just policymakers, but it's medical providers, it's researchers, it's academics, and it is also the caregivers who need to be at the table developing these policies. Senate Bill 48 is a perfect example of a lot of folks coming together to understand how we could work on increasing early detection and diagnoses, but do so in a way that supports and incentivizes that particular work.
I have never felt more hopeful than I do right now. When we look at Governor Newsom's master plan for aging, it's been a catalyst for change in California and nationwide. Today, more than 20 states are following California's example. When our state Medicaid agency, Medi-Cal, invests $25 million in dementia care aware, it gives me hope. And when our state rolls out Healthy Brain Initiative funding in more than a dozen counties, it brings hope to local communities.
To be able to provide the best level of service, the best level of care for our aging Californian population, we are going to have to take up this charge and run with it. It truly is the future.
By incorporating early screening and detection of dementia into their regular meetings with patients, primary care teams can do so much to improve the lives of individuals, families, communities, our entire state. California can become a model for showing how brain health is an essential part of whole person health and whole society health as well.